Norman, good morning. The first question I'm sure all of our viewers would want me to ask you is, how are you?
Yeah, it's a bit weird when you've got man flu and it becomes national headlines, I have to say. So I'm fine. I've got the flu.
Yeah.
I'll find out today whether I've got coronavirus.
We hope it is man flu, Norman. I'm sure everybody agrees with me on that, and good luck for your test results today. Just following up from your piece on 7:30 last night, take us through where we're at the moment, and can Australians take much encouragement with the ever so slight softening of the curve in recent days?
Well, that's what we're looking for, and it's really fantastic news. These things change day by day. There are two things to know about that curve. Sadly, that the Ruby Princess is probably still, the people off that are still to flow through the system, I think, completely. So you may see a bit of a surge there, which would be disappointing but expected. And there are lots of other cruise ships as well. So we've not, whilst you've just seen a video from somebody who's been quarantined, that's a very recent phenomenon, and we've allowed a lot of people from overseas to come into the country without really being properly checked and trusting voluntary quarantine. And that will still flow through the system and see a surge. But under the graph, so beneath the top line of the graph, and you look at the different types of people underneath, there's a small but rapidly, exponentially growing group of people who are community spread with no known contact with either somebody with COVID-19 or they've come back from overseas. So it is spreading in the community. And the trouble is the testing regime, big though it has been, I mean, we've done a lot of tests compared to other countries, there's no question about that, but we've been looking for people who've come back from overseas or contact with somebody with COVID-19 by and large. To really know what community spread is like, you've got to check everybody with symptoms, and we haven't ramped up to that level of testing yet. And I'm not suggesting here that everybody with symptoms goes out and gets checked, but nonetheless, that's what we've got to do. And we've certainly got to do it if we actually want to get back to normal life as soon as possible, because unless we've got that testing regime in place, we won't know. So that's the underlying concern. But I mean, one should rejoice that maybe we are seeing the top coming off the curve.
Norman, people often email in to us looking for the good news and saying, why don't you ever report on all the people who've recovered from it? That's a bit hard to do though, isn't it? I mean, how do we sort of keep a track of those numbers who've made it through to the other side?
Well, I mean, the fact is we've had, I can't remember the number of deaths, but it's tragic, absolutely tragic, the number of deaths we've had. But I think it's still under 20 in Australia. And there have been people possible. Basically, everybody else has recovered. So I mean, it's a large number of people. If I've got it, in a couple of days I'll be fine and come through the other side. So the here's the numbers of 100 people who get this coronavirus. 85 will be fine. They'll have mild disease or maybe no symptoms at all, which is one of the problems for spreading it, but we'll come back to that. 15 or 20 will end up in hospital because they're quite sick. Most of those will be older, but not all. There'll be quite a few younger people in that group. And of that 15 or 20, probably 5 will need intensive care and 2.5 will get into serious trouble, and maybe 1 of those will die. The mortality rate internationally has been moving around a lot and people are confused by that. But a paper in The Lancet last week looked at the various mortality rates and said that basically it's very common early in the pandemic to have confusion about the case fatality rate. And it's because we don't know what the denominator is, the number of people who are infected. And they took as their experiment, if you like, the Diamond Princess cruise ship, because they knew exactly who was on board, who was infected, and who died, to be brutal about it. And the mortality there was less than 1%, and they were an older group of people. So the average in Australia is going to be much less than 1%, maybe 0.5%, but that remains to be seen.
Hey, Norman, one of the most popular questions that we're still getting all these weeks into this crisis comes from Maggie this morning. She wants to know whether wearing a mask or not wearing a mask is the best option if you don't have the coronavirus.
So if you, if I was in the same room as you, but I'm not, I should probably wear a mask to stop giving you what I might have, even if it's just man flu. So wearing a mask if you have got it is a good idea because it stops that droplet spread. if you are a healthcare worker, somebody who's working close by somebody, a dentist, that sort of thing, you would wear a mask to protect yourself from that droplet spread. It's controversial, the extent, so there's no question that wearing a mask in public will protect you to some extent, but the number of people who've got to wear a mask on every day for one person to be protected against infection is very, very large. So it's not as if it doesn't protect you. That's misleading to say that that's the case. But it's a public health thing, is that if you've just got to give so many masks out to the community for such little benefit, because the risk is low to catch it from the air in the world around you, that it would wreck the supply chain for people who really need it, such as healthcare workers. So the fact is, look, if you've got a mask you want to wear outside, it might protect you, but it's not something you want to encourage, because the chances it's going to protect you are very small.
Norman Swan, thank you so much for joining us this morning. And there are so many messages here from people saying, get better. Yeah. So thank you.
Thanks very much.